Hello, my name is Aziz Sumro, and I got a call from an old friend in the community who just turned 65, and he had asked me to visit with him tomorrow, Tuesday, the March 24th, to sort out all the information that he's getting for the last 3 months on Medicare. What should he do, Medicare or Medicare? He heard of Medicare Supplement or Medicare Advantage Plan. You get tons of information, mail from many insurance companies and brokers and advisors. There are close to 7 to 10,000 advisors in Texas. So he's confused. So he wants me to visit with him tomorrow, Tuesday, and what's going on uh, today, as we all know, this coronavirus situation. Everybody is skeptical and careful, of course, and thoughtful and to take a preventive measures to minimize the visits. So I'm going to make this a short video, maybe 10 to 13 minutes or less. I'll do my best to speed up and send this to him and see if this helps him answer some of the questions that he has and clarify things for him to make a decision and have a, be happy about it. So here it goes. When someone turns 65 for first time, 3 months before they turn 65, they do get out invitation from Social Security to take an option on their Medicare, also as well as their Social Security. So they are given that 7 month window, 3 months before they turn 65, the month they turn 65, and 3 months after to, to, to opt in with both the Part A and Part B of Medicare. And along with that, they will choose either to go with Medicare Supplement to cover the gaps, which original Medicare has gaps, to either with the Medicare Supplement along with the prescription drug card, which comes at a cost, or Medicare Advantage, which is in many institutions there's no cost. It covers A and B, Part A and Part B, as well as prescription and other benefits. So here's a basic idea or basic picture, simple picture for a new person who turns 65 to make some points, make some notes, and hopefully at the end of this conversation, uh, it'll be clear, I'm sure. Otherwise, I'll still be available to follow up with more detailed information and answer more questions which are specific to their own needs and concerns. Here it is. Medicare, original Medicare, red, white, blue card that we get, which has two parts. Part A, which is a hospitalization. Anything to do in the hospital falls under Part A, which is there's no cost, a monthly premium for that Part A hospitalization, because over the years seniors have earned enough credits to have that free hospitalization, which is Part A. And then Part B, which is anything to do with outpatient, like doctor visits, specialist prescription, that kind of thing. Anything outpatient for common cold, common flu, checkups, that kind of thing, prevention. That's Part B. Now, Part B, depending on what year you're, you turn 65 and how much you have worked, how many hours credits you have worked. Part B comes with a monthly cost, monthly premium cost, which ranges from 134 to 145 a month, which comes out of Social Security income if you have opted for Social Security income. If you're delayed, which is okay, then you have to pay that manually through bank draft or whoever way, make arrangements to pay to Medicare that premium monthly premium for Part B. Having those two, Part A and Part B, with original Medicare, which is recognized, the card is recognized at every hospital and doctor, they take those. However, both have out-of-pocket costs. There are gaps that you have to share along with Medicare. You have to, they have to pay some, and you have to pay some. On average, like a 20%. So, for example, if you're hospitalized for a couple of days, as you know, a couple of days, a hospital bill could run 100 to 200,000, even for little things. And that having Part A Medicare original, that means your share could be responsibility could be $20,000. What if you stay there 7 days or more? Then your share goes up. So there's no cap on your expenses. What could be? So you are jeopardizing your saving, hard-earned savings and investments and property, whatever you have, if something major happens. Same way with Part B also, there are caps. And also, of course, this original Medicare does not have a prescription card at all. So you have to have a separate prescription card, which is about 35 to 55 a month, depending on what card, what company. So this is original Medicare along with prescription. Most people, almost 98% people, they have figured out between Medicare Supplement and Medicare Advantage what to take. That way they limit their out-of-pocket cost. Having Medicare Supplement, which you probably have received tons of information and booklets in the mail, they have A, B, C, D, E, F, and different GH plans. No, but regardless what plan you choose out of A, B, C, E, F, there's a monthly cost. Now, of course, now you are limiting your out-of-pocket cost, but there still is out-of-pocket cost. You have to share some, depending on what plan you choose. On top of that, you have that monthly premium too, from the insurance company, Blue Cross or anybody, United or Cigna. There are too many. Aetna, there are too many out there. United, there are too many to name. But you are paying the monthly cost. And along with Medicare Supplement, which started in 1940s, 47 or so, there are a lot of successful companies, and people had, along with that, you have to get that prescription plan also from that company or other company. That prescription plan costs 35 to maybe 55 to $60 a month, depending on the company and level of prescription coverage that you are getting. So there's two costs: Medicare Supplement and prescription under this more original popular supplemental plans to offset what Medicare Part A and B has missing. However, on the left side here, which is most popular, I'm age 70 myself, and that's what that's my personal opinion, that I will take, which is called Medicare Advantage Plan, which has Part B, A and Part B, also prescription, card and benefit in it. Also, they throw in an extra, like you've heard of silver sneakers and transportations and vision and dental and overseas travel, that kind of deal. It has more richer. And now, since the government is paying these companies to provide services, Part A and B, and prescription, there's no monthly premium for seniors at all. Some plan, there are three or four of them, popular ones, no naming any companies, they even give back some amount from 85 to 95 to 125 to 135 a month, not directly to seniors but to Social Security to pay for the Part B premium. So your Part B premium will be paid, so that means your Social Security will go up that much, like $89 a month. One company does, which is 1,080 a year. So you will see that much Social Security going up for you because your Part B premium has lessened now because they are paying the difference. So that is where there are PPOs and HMOs choose from. My personal choice is HMO because containment. Containment. What happens is now your out-of-pocket cost. If your bill is $1 million, you will notice there's a maximum out-of-pocket cost, which comes from the co-payments and your share of deductible that situation like that. That the MRI, X-ray, lab, and all that. Your co-pay comes out $3,400 in HMOs, many of them, and 6,700 on a high end from PPOs. That is where you are limiting your out-of-pocket cost. So if you keep that in mind, this little sharing that's going on will not bother you at all. So that is what I wanted to, give a summary right now, not just all the presentation, but summary, and hopefully Medicare.gov, of course, has more detailed, similar information, but I just summarize here. So in review, original Medicare has Part A and B, but no prescription, but have a limitation. You have to get a separate prescription card plan, which they call PDP, prescription drug plan, from the insurance companies, ranges from 30 monthly 35 to 55 a month, depending on the company and their velocity coverage. To offset that, to limit your out-of-pocket costs, most people take supplement A, B, C, D, E, F plan, which you pay a monthly premium. It ranges from 99 to 150 a month, plus you pay separate prescription drug $35 to $55 a month. So you have something, you are paying a premium on a monthly basis to offset, minimize your out-of-pocket costs. And here on left side is Medicare Advantage Plan. No cost to you, no premium to you. In some cases, you get something, get money back, 89 to maybe 135 a month. And it has A and Part B and also prescription and vision. Here, one company gives about $3,000 towards hearing aid. And there's a dental also, so you have to see some dentals are reimbursement, not a full dental plan, but they provide that. And so that is a summary of Medicare basics for the my senior community members who are turning 65 for the first time. But if you've been there more than a couple of years ago, you already know this already. Only thing you do every year is we don't have to, unless your plan changes. You have an annual enrollment period start from October 1 to December 7th for seniors, which is an AEP, annual enrollment period, where you could just see what else you are receiving every year. You will receive this much information from all the insurance companies, put in the bucket, and sort out between October and December 7th. Either one, keep what you have from last year or change to another one. And so that is a summary. I just wanted to make this a summary. And hopefully when I send this to this friend of mine in the community, to hopefully he will see that we don't really have to meet. We could hopefully answer some of his questions. But whoever needs more information, they could send me an email, which is I have two email addresses. One is Aziz, A-Z-I-Z, at ambest.com, A-I-M-B-E-S-T. Another one's very easy to memorize, actually, the email address. Very easy one. It's a plan, P-L-A-I-N, insurance, together, lowercase, plan, like a plan you P-L-A-I-N, insurance at gmail.com. And My website is very easy also, where you will see as to what I have been blessed with for the last 37 years. I started in this business in 1983. I had three mentors at that time, core mentors at that time, 1983. They had 30 years experience. That's M, AIM, best. It's all together, mbest.com. Thank you for your time, and hopefully I kept this short, and look forward to assisting whoever has any more questions at any level, and not only in this area but any other areas of insurance and financial planning. Again, my name is Aziz Sumro.